Hello, I'm Zachary Mead, and today I'll be presenting on a study about focused ultrasound thalamotomies for multiple sclerosis-associated tremors. So a little introduction. So what is multiple sclerosis? It's a disease of the central nervous system that can result in nerve damage that disrupts communication between the brain and the body. In its simplest form, specific to MS, lesions form within the brain that causes issues with thinking and movement, has other effects as well. Specifically, it affects the less myelinated regions. So in this relevant study, tremors are a common symptom of multiple sclerosis and are difficult to manage and can oftentimes be debilitating for people that it affects. So previous approaches to solving this problem are surgical thalamotomies and deep brain stimulation that can provide relief from these tremors for the victims of MS. But as one can imagine, this procedure is often dangerous and very invasive. So what is a thalamotomy? A thalamotomy is a procedure used to treat tremors by destroying part of the thalamus, which is, in this case, in the case of MS, it's the area of the thalamus that is damaged, which is causing the tremor. So in this study, they're using magnetic resonance guided focus ultrasound, or MRGFUS as it's abbreviated. It has been developed as a non-invasive technique that allows for controlled focal brain lesions as a way to perform a thalamotomy-like procedure, but not quite exactly a thalamotomy. So this is interesting because it's been approved. This ultrasound wave has been approved for treatment of Parkinson's by the FDA, but it's has also being shown in this study to be proven to be useful for multiple sclerosis-related tremors. In this study, the study subject is a 28-year-old right-handed female who was diagnosed with MS at a very young age. So in her case, an MRI showed periventricular hypertension lesions, but she says over the past 2 years, she'd really shown no prior change to this. The subject is also right-hand dominant, so the scores will be done through her right hand. So a little bit about the results. So not talking about the image on the screen, but the female in the study scored a baseline score of 29 on the clinical tremor scale, 0 being not debilitating, 32 being debilitating, so that's a pretty high rate for her right arm, or right hand. So in this figure on the screen, it shows a couple things. A is just a baseline photo of periventricular hypertension lesions at baseline. Now, the interesting image really is B, where it shows the left thalamotomy at the baseline, at 24 hours, and at 6 months post-procedure. And it shows that there's really no swelling or fluid buildup at 6 months, which is really interesting. When they did this study, ultrasound beam entered the skull, attaching to the deep brain structures, causing thermal ablation, heating up the area from 55 degrees Celsius to 58, which kind of caused this edema, which we'll then kind of talk about the problems with that later on. And then to kind of counteract this, lesions were monitored real time so that they could really make sure the patient did not get hurt. So after the procedure, the subject had some symptoms. They had a right side asymmetries, droopiness, and then there was a reduction over time. Almost took 12 months for this kind of clear up. But after a while, so at 3, 6, 12 months later, she showed approximately an 80% reduction in functionality of her right hand. So her initial baseline score of 29 out of that scale of 0 to 32 went down to 6, which is incredible. So a little bit about this research. So tremor controlled is achieved by the thalamotomy using ultrasound beam technologies. MS, they kind of showed that it's not always optimal for deep brain stimulation, it only is really good in some cases. It can be problematic because the thalamotomy is a procedure that's not really reversible, not a reversible treatment, and as MS is not always fatal in a lot of cases, this can sometimes worsen their disease if it's probably not done correctly. So to prevent side effects They also have to be like really intensely monitored, clinical monitoring, very accurate. Um, on the neurological side, showing the side effects, and it even showed her side effects lasted for mostly cleared up after 12 months, but never really fully cleared up in the time of the study. So some of the advantages to deep brain stimulation in this phlebotomy is it's very cost effective to comparable treatments. It's non-invasive and non-surgical in some aspects, meaning that there's really lower infection rates, less room for the patient to really get seriously bodily harmed. It also avoids implication for implanting mechanical devices, which is important for MS because they're going to need future MRI scans where if these devices were to be implanted, they could cause serious issues. So some future implications of this study, it really showed that this could be used to treat tremors and comparably to Parkinson's disease, as well as looking at deep brain stimulation for things like Alzheimer's, and how it really can be useful for people who have really debilitating tremors in MS, but it's really a hit or miss on what kind of tremors they have and where they come from within the brain. Thank you very much. That's the end of my presentation, and this is the reference.